Hi, in this video blog, I'd like to talk about CST, CranioSacral Therapy and home care. Now, we've discussed in previous blogs about aging in place and treating at home, but I'd like to go over just a little bit of the practical nuts and bolts for everyone so you can understand how you can get to learning about craniosacral therapy to actually having it implemented in your home care for your loved ones. And I think the bottom line is if you're a caregiver or an adult child of someone with Alzheimer's dementia, it makes sense you might be a little skeptical about all this. So one of the things to do is to get more informed and then try it out on yourself. As the old saying goes, trust but verify. So one of the things you can do, of course, is to read this book over here, Prevent Alzheimer's in Just 10 Minutes a Day. That can give you some perspective if you like to read. Or there are video downloads of DVDs that we have that you can also go to preventingalzheimers.com to read. And then another resource we have is trained longevity therapists in every area. So again, you can email us at info@preventingalzheimers.com to find out where there is a qualified longevity specialist in your area. And they can be a resource for you because you could go to them and actually get a craniosacral treatment or find out how to get a still point inducer, which is a low-cost device you can put behind your head and actually experience for yourself craniosacral therapy in a very mechanical way using the still point inducer. But I would advise you to actually get a treatment from a therapist to feel what this feels like. So you feel and understand, firstly, this is a very non-invasive procedure. It's not going to hurt anything. And most probably, you're going to feel some relaxation from the treatment. And I like all the caregivers and the family to get a feeling of how this feels before we even try it out on your loved ones. Then a therapist could come to your home and maybe give your loved one a patient if they can't make it to someone's office. Number of ways they can experience the therapy, or you can get a still point inducer and try it out on your loved one yourself. And then the idea is over time in implementing the procedure is that you could try getting some regular treatment on your loved one over 2-3 weeks and just notice the difference. Just notice every day if you can structure a daily care or as often as you can from someone who may already be visiting at home getting care, or finding a mechanism to do that, and your trained longevity therapist can help you on the practical implementation of that as well. Then you can get a feeling of how this is working because you want to kind of see and feel it out and monitor. That's what we're really encouraging you to do as we're implementing this program. And then you can figure out, in doing this 10 to 15 minutes a day, whatever time of day you can do it, how things are working. So that's what I'd like you to try, to get informed, to feel it on yourself, to feel some relaxation. Almost anyone in this culture would love to feel a little more relaxation and a little more silence and a little more quietness, which the craniosacral therapy will do. And then you can avail yourself of all these other programs to see. But my suggestion is try it for yourself. See how it feels. Then we can implement that for your loved ones at home. So just a couple of more practical thoughts in how to make this program work for yourself. Okay, we'll talk to you again soon.